So, another element in protecting incompetent patients would be this idea of surrogate decision making, and that would be more for people that don't have an advanced directive. So, there are qualifications for a surrogate decision maker. They have to be competent to make a reasonable decision. They need to be educated and really well informed on all aspects that will make up this healthcare decision. They need to be emotionally stable to make a decision like this. And they also have to have a clear interest free from, like a conflict within the family or a different motive for needing something in order to make this decision. Those are just some things we would look at as far as what would make up a good surrogate decision maker for a patient. And then I just listed out some of the roles. So we look at the role of the family in decision making. We assume that the family would best understand the deepest wishes of the patient, and so we want to utilize family in that way. We would hope that they would truly know what would be best for this person as far as healthcare decision making. And then we look at the role of the healthcare professional. They're really there to keep informed the family. They're trying to help make the decision-making process as easy as possible by informing the family and keeping them updated and giving them all the information necessary to make a decision. Healthcare providers can also identify if, like, a durable power of attorney is possibly making a very unreasonable decision for this case, and they can help get ethics involved if that would be necessary. Then we look at ethics committees. They're really there to provide education and utilize policies and procedures that would help formulate a decision, and that would more just be if there were kind of differences in views on what should happen for the patient, or just to kind of help facilitate the decision-making process if need be. And then there's also the judicial system, which would be kind of a last resort. They can kind of help remove family members from making decisions if they are not fit to be making them, or they're making a decision that seems wildly out of place. And they can also reappoint someone new to make a decision if that would be the best case scenario for them.